Welcome to Tea with Tanya. I'm your host, Tanya Ambrose, an average millennial navigating life as a maternal health professional, nonprofit founder, and grad student. Join me in the tea tasting room where we spill the tea on finding balance and promoting positive living while doing it all. Hey friend, welcome back to another episode of Tea with Tanya. I am happy to have you back here in the tea tasting room with me. It's always a pleasure and a privilege to be able to talk it up with you every week. Now, on today's episode, I will say today's tea came highly recommended by a fellow podcast sister. So shout out to Lucy over at the Bar Babble podcast for recommending this tea. And it's London Fog. And if you have a love for chai, this is something that you might like. So it's basically the Earl Grey tea. So you can probably use the Twinning brand. Shout out to Twinning, I guess. But you can use the Twinning Earl Grey tea and you can mix that with some milk and honey and add a dash of cinnamon. And she recommended that. And I've had the Earl Grey with just milk and brown sugar. So I've never tried it with honey or even the dash of cinnamon. And I've been doing that. And let me tell you, and I do add a little bit of nutmeg because I'm just Antiguan and I can't help myself. But definitely try this. It just tastes amazing. And it's been a staple in my daily routine, whether it's morning, afternoon, or evening tea. I do have a cup of this daily. So shout out to Lucy over at the Bar Bible podcast for recommending this to me. Now, for today's episode, I'm going to be talking to someone very near and dear to my heart. And I know I say this about every guest, but again, when I talk about the power of social media, I met her on social media. We started following each other, and long story short, we're now tied together. This is someone who I look up to, someone who I admire, someone who, she doesn't even know this, but she's becoming slowly a mentor because the way she encourages me, the way she supports me and the work that I do. It's amazing to have a fellow Caribbean sister who does amazing things to encourage you and support you and to have in your corner. So I'm definitely excited to be speaking to Dr. Trotman today. She is, and of course, you know how we do it here. She's going to introduce herself, but I just want to point out that she serves as the director of Pediatric and Adolescent Gynecology for the Mount Sinai Health System. She's an accomplished OBGYN. So I'm just excited. We're going to be talking about addressing health literacy in our overall health, reproductive health prevention and maintenance, our menstrual cycles, sexual health, and the knowledge of our body. These are some of the things that we're going to be talking about as we try to understand our anatomy, as we aim to be more healthy and more knowledgeable of our bodies. And the key term here is health literacy and body literacy. So I'm excited to be talking it up with her today. Well, welcome to the tea tasting room, Dr. Trotman. It's a pleasure to have you here, looking all beautiful on my screen. It's it's a pleasure to have you finally here in the tea tasting room. And like I mentioned earlier, that we met on social media randomly. I don't even remember how, but we met there randomly, and for some reason we just connected. The energy was good. Then I saw you in my country like a week before I was going, and I wanted over that for a little bit, and here you are in my life. I mentioned earlier in the intro that I consider you a mentor, even though I didn't tell you that, but you're someone that I look up to, and the work that you're doing in this community is very, very important. So I'm happy that you're taking time out of your very, very busy schedule to talk to me today. Because guys, she is a superwoman. I mean, I don't know if that's the right term, but she is doing it all, doing what she got to do to ensure that our society is better. So tell us a little bit about yourself and don't leave anything out, okay?
Oh, God. Thank you for that intro. Yeah, I think, it's funny because the social media thing, I'm not big on social media, but the minute I stepped in, so many great things happened. So meeting you, and I do feel that nice connection, and I love it. It's like my next place I have to take. So I am Gylynthia Trotman. I am a pediatric and adolescent gynecologist in New York City. So what does that mean? That means that I did OBGYN for training. And after, I just found my passion for the younger population.
Yeah.
So I take care primarily of children and adolescents, young adulthood in my day-to-day. So day-to-day work involves a lot of education. And that is my passion, health literacy for really all comers, because, pediatric gynecology is something that people don't know about, but particularly for our people. So for people of our background who tends to come from a low health literacy place and a low resource place, and recognizing that you don't need a lot of funds to actually promote health. You just need the knowledge. So that's my thing.
And I'm happy you said that, because I think that's one of the things that we connect with too, because I have a nonprofit and one of our goals is to provide health education to adolescents and young adults as well, even the younger ones as well, because it's preteens, whatever you want to call it, because again, coming from where we're coming from our background for our people, health literacy is not a thing.
Nope.
We're now just starting to see the word body literacy or health literacy becoming a little bit more popular, especially because of social media. But again, that can also, there are other things on social media. Like I have a love and hate relationship with social media. Like it's good for educating, it's good for networking, but then there's also a lot of fluff, a lot of misinformation that's out there. So I'm happy that I'm here to talk to you as it relates to health literacy, knowing about our different anatomy and these different things, because it's important.
Yeah.
So my question is, when you talk about and talk to me, I wanna learn. Even though I may know some things, I don't know everything. And like you mentioned before we started this episode, good is enough. I don't want to be perfect. I don't want to be here, even though I'm the host, acting like I know it all. Even though I may know enough, in my opinion, but for me, every day is always an opportunity to learn something new. It doesn't matter if it's in the field that you're working or not. So talk to me or my listeners when you talk about health literacy. What exactly does that mean when we're talking about that?
Yeah. So, the important thing is that even as a provider myself, and I've been a doctor for too many years to mention, I only in the last couple of years came across the term health literacy and understood what that really means. So that means having enough knowledge, having enough information, and having enough agency to know what's happening for your body and then make the right decisions for that. So a lot of times we may have the knowledge and the information, but we don't have the agency, we don't have the autonomy in order to make the right decisions or in order to advocate for ourselves. So literacy spans not only the knowledge, but also the action, right? And that's when we're literate. And, for a lot of people, regardless, we just don't even have the knowledge, right? So, pick any family member or you're on a med. What meds are you on? Oh, I don't know. The doctor raised it, blah, blah, blah.
So my pressure pill. But what exactly is your pressure pill doing?
Because I have a pain in my neck, when it's completely not supposed to be managed that way, right? Or the way the angle that I come from health literacy is more of a public health angle. So that means preventing, having knowledge, having agency before we actually develop some of the diseases or develop some of the syndromes, or if we get them, not having to necessarily struggle and suffer before we get them managed. So that's why I absolutely love the younger demographic, because this we have the opportunity to instill that literacy, and they don't even have to put a name on it. Like they don't have to consider that, oh, I'm health literate. They just have to know it's always this way. Yes, I know my body. I know what's normal for me. I know this is not normal. And if something comes up, I know who to tell and where to go, right? So that's just my definition. Someone may have another one, but that's just how I see health literacy.
And I think for me, one of the ways I see it too, as I'm listening to you talking, is making sure that we're calling things by the correct term as well. Again, everybody's not going to know the right term for everything, but when we're talking about understanding what's going on in our body, I've heard so many terms that some were so new to me. I'm like, okay, I'm not that old, but where have I been as to why I've never heard this word? Or let's say, like for instance, I've heard so many terms for the vagina.
Oh yeah.
Granted, we have, let's say one of the terms is vulva, but people are not going to say, oh, my vulva. We're going to say the vagina when it comes to understanding that part of our body. But I've heard so many different terms, and I'm like, okay, like when we have our events back in Antigua for my nonprofit, and we're asking the younger girls, and these are like 8, 9, 10-year-olds, like, do you know what this part is? And Dr. Trotman, some of the words that I heard, I was like, how old are you? Oh, I'm 9, I'm 10. Who is teaching you these words? But again, when you're coming from a particular background, it's just not, I guess it's normal. It shouldn't be normal. But then again, that's where the health literacy comes in. So I want to touch really briefly, maybe if you can, even for listeners, like when we're talking about the vulva and the vagina, like explain to us that difference, and then we're going to ask how we can improve our health literacy as well. But what is the difference? Why do you think it's more common for us to call it, oh, my vagina, or the other words, versus the vulva, which is the actual right term for it?
So first, I'm so happy you brought up this word about the vagina. I spend all day telling 4 to 5-year-olds what the right word is. And I remember we never called it vagina either, right? That's just all the other words that you use for it. Some of that, even before thinking about the difference between the vagina and the vulva, some of that is vagina as a whole, it's a bad word or it's a private area or it's something that in multiple
down there.
It's down there. In multiple societies, women are not supposed to be like happy and proud about the vagina. Have you ever said the word vagina out loud in like a random place? Everyone's gonna look at you, right?
It took me a while to be comfortable even saying the word vagina in my age, in my era of life, you know?
Exactly. So the first thing is a lot of the cultural norms universally really around that's a bad word, that's a bad area. We keep that to ourselves. We don't really say it. So we change the word for it to words that are more acceptable. So whatever the words we use, or, here in the States, a lot of people may say their cookie or their flower, all types of words you teach these little girls, little people to say. And that has a lot of problems. Number one, it puts shame on a part of your body that's normal and healthy. That's number one. Number two, for the younger children, it actually sets them up for the risk of care providers not knowing that someone has touched them inappropriately. So if someone goes to the teacher and says, XYZ touched my cookie, that teacher may not realize that means that they touched their vagina, right? It may their vulva. They may think it's a literal cookie. So I spend a lot of times teaching families, caregivers, children to use the right word. So that's the first thing. So vulva and vagina. The vagina is the tube inside of the body that connects the external genitalia, which is the vulva, which is what we see, which is the part that the hair grows on called the mons, and the labia majora, which are the fatter lips. The inside of that is the labia minora, which are thinner and sometimes extends beyond the majora. So the vagina connects that area with our cervix and our uterus on the inside. So no one, I can think about very few times people would actually see the vagina. So when people they looked at my vagina, what they're actually speaking to is the vulva. So the vulva is that part of our anatomy that we can see on the outside in people that were born with a female genitalia, while the vagina is a tube on the inside. So that's the clear difference. It's used interchangeably just to make it easier. But truly, if we're teaching our young ones, we should be teaching them about their vulva, the part that we clean on the outside, and the vagina, the tube on the inside that no one should see.
And I'm glad you explained it that way. And I hope you guys listening will get a better understanding. Again, nothing is wrong, essentially, if you were to say vagina, because again, it's what's commonly accepted. But when we're dealing with the younger population, it's very, very important that we're using the right terms. And I do want to jump in with a question that I don't know if I should leave it towards the end or not, but when we're dealing with the younger population, when it comes to parents and talking about, again, teaching their children about their different body parts, how can a parent that's listening, or an aunt, or someone who's working in the younger population, how can they address, I guess, these issues? Because again, a child coming to a teacher, oh, my cookie, I'm thinking, okay, was it chocolate chip or was it an Oreo? Right. I'm not thinking, your vagina. So again, if a parent is telling, because again, there's a stigma attached to talking about our private parts, even saying the word breast has been stigmatized as well. I was like, for years, I was like, oh my God, not my breast. I can't even say it.
Yeah.
Again, growing up in the culture that I did as well, it was something that I didn't feel comfortable even saying out loud. But how can a parent, when talking to their child that's growing up, when they're talking, because, I guess I'm thinking of one of my developmental psychology classes that's been years now, I probably forgot, but they talk about, I guess, children seeing their parents in a different way and seeing certain parts that they identify with the same-sex parent or whatever the case may be. But how can a parent essentially talk to their child about using the correct terms for their body part, maybe talking about good touch, bad touch? That's something that we deal with when it comes to Scrub Life kids as well. Like how can we, I guess, foster that communication with our parents and child, and then of course with the provider as well?
Yeah. So the first step, and I get this a lot too, and these questions, although we identify culturally, it spans all cultures, I'm telling you. And it's really universal. The first thing is the parent or the caregiver being comfortable themselves. And that is what I find usually the issue. So, I have a lot of moms, even last week, how do I talk to my 5 and 7-year-old about these things? And I thought it was interesting because the older child is already 7. So it's like, whoa, that means you have not even broached these.
Yeah.
What is it? So they're also coming in with their own lived experiences, right? So, when they were growing up, many, many times, this is behaviors that their own caregivers mirrored or we also don't know if parents are coming from a background of having some sort of trauma, some types of intimate violence, or there's so many different things they bring into the table. So the first step is the comfort of the caregiver or the parent themselves with those words and knowing what the anatomy is too. So educate yourself. How is the best way to get that? Educate yourself from reliable resources, right? So I don't like Dr. Google, but Google sometimes a bane of my existence. And social media too, although I'm so happy you mentioned the gift and the curse of it. But there are actually some credible sources with both, right? There are sources you can go to from Google or from social media, from licensed professionals that can give you that information. But I actually have parents use certain books and certain like child appropriate books first to read for themselves and educate themselves, and then bring those age appropriate books to their children. So there are some books that are targeted to like 6 and 7 and 8-year-olds before through puberty that talks about the anatomy in language that's appropriate. Lots of pictures. At that point, you want to really focus on pictures. Yeah. Lots of pictures that they can look at. And together, the parent or caregiver and child can learn together. The earlier you start that, the more you are actually empowering your young one to know their body so that they'll know when something is wrong or when someone's touching me hopefully it doesn't get to touching, or when someone's approaching them in a wrong way, they'll be empowered. So they're going to grow into a person that actually takes advantage of their health a little bit more, just because they actually know. The amount of teenagers I have that have no idea what's happening down there and how to clean, having a little bit of pain, and they're nervous and they're afraid and they're suffering for months. And it's like, oh no, this is simple. We can just do this, right? So in order to get that language, I use simple language with parents. I'm like, just start. If they're not comfortable, find a resource that works for you. Sometimes I can help them with some resources, or sometimes in the office, myself, the parent or caregiver and the child, we're doing it all together. So I'm like, what's this called? What's that called? This is the name. What do you call it? Okay, there's certain things, and some of these children or young ones, they know. And the parents are like, yep, I told them since day one. I've always been calling it the vulva. I've always been calling it the vagina. And parents who are not comfortable, if you can verbalize that, then get the books, get the right tools, but you should not shy away from it. Or if you're like, I can't even go there, then bring your child to a care provider that can do those things for you with you in the room. You'll learn a lot from that as well, right? Pediatricians, pediatric gynecologists like myself, family practice doctors. There's a lot of people who can fit that role.
And I want to talk about, again, ways we can improve health literacy, but also what are some information or some key information that we should be aware of when it comes to our reproductive health, like prevention and maintenance. Because for me, I will say this, I'm a public health professional. I have whatever knowledge I have, but whenever it comes to me to go see my primary care provider, like I can guide somebody, I can tell my sisters or friends, I will give them an entire list of things to ask their provider. Yeah. When you go into the doctor, if the provider is saying something that we don't necessarily agree with, I'm telling you, I'm teaching you how to speak up for yourself. But when it comes to myself, I am not necessarily taking my own advice, to be honest. It sucks, it's not good. I'm not encouraging you listening to be like me. I'm working through that. But for some reason, I don't know what it is. I just associate having to see my doctor or having to see my gynecologist that I'm going to have something negative. They're going to tell me something negative towards the end, right? Yeah. So sometimes, even though I'm going into my provider with some set of questions to ask based on how I'm feeling with my body. Because again, I think when it comes to health literacy and our body literacy, being in tune with your body to an extent helps as well. Because we can't expect our providers to help us if we ourselves don't really know, our bodies or know about different health issues. But how can we improve, or what are some information when it comes to preventing or maintaining? Because sometimes people are not going for their pap smear. If you're of that age, people are not doing that. When it comes to, again, for our younger populations, I know, again, in our culture, if you're 11, 12 and you're having to go see a pediatric gynecologist, are you fast or you're forthright? Like, why? There's some negative connotation. Yes. But it's a part of just, again, preventative measures.
Yes.
So about, a 12, 13-year-old having heavy periods, having severe cramps, throwing up, cannot even go to school, should not be normal. And I remember growing up in my high school, I had classmates who would throw up when they're on their cycle. They would bleed extremely heavy. They would have severe cramps. And we all just said, oh, that's normal. That's just her. That's, that's just them. And, it doesn't affect me right now, but that's just them. So we accepted it. So again, what is some key information for what is parents listening or someone like my age, whatever it is, the young adult, when we are going to see our care provider? Like, why is it that we're so afraid, or what should we be knowledgeable about when it comes to preventing and maintaining when it comes to reproductive health? Because we're not, where all this world is running right now, we have to make sure that that's a priority as well. So what are some things we should be knowing in regards to that?
Oh, that's a big one. So I have to take that in a couple of buckets.
Yes. I know I said a lot too, I have to get it.
So that's the truth. I agree with everything you say on a personal level, on a population level, on a thing level. So the first thing is the doctor the fear, right? That stems from a variety of reasons, but there is a shift in power dynamic. Even as a professional myself and a gynecologist, when I go to my GYN, everything I had in my mind is out the window. I don't know what it is. So all of a sudden, she walks into the room and everything is great. There is no problem. So there is a true hierarchy, a true sense of, I want to please that person. That's probably not even the right words, but you don't want to come across as bad or
needy,
and that is personality dependent, because everyone is like that. Some people are like, here comes my list of things, and you are not going to leave until you answer every last one of these questions. So some of that is some internal work, right? And I do the GYN specific does come with a little added level of fear and of concern and of worry, because again, it states back to how we deal with our reproductive health and the fact that this is stuff that we've kept very private. We don't talk about this. People talk about their high blood pressure all the time.
Oh, my high cholesterol. Oh, my cholesterol is high.
What's acceptable? Diabetes, cholesterol, hypertension, headaches, migraines. How many people are you going to be in a room talking about their vaginal discharge and talking about, oh, my vaginal discharge doesn't smell good, or my vulva is itchy, or I'm bleeding all the time? The room is going to be empty. No one's going to say anything, right? So we don't have that same sense of community, that same sense of support. Like, go talk to your doctor about that, because it's not normal. So you're coming a lot of times with that too. And then there is a lot of, let's not forget, there is a lot of reason to mistrust the healthcare system in some, and in many settings. There's a big mistrust of providers. There is warranted mistrust of providers. That's a whole other podcast as far as historically what has happened. And now what I find is, unfortunately, we have historic facts that now people are now limiting access to care, or unable to kind of get past that, when, a lot has changed, or there are lots of good care providers who can give you the care that you're supposed to get, but you're not even getting to them. Why? Because I'm afraid, I'm scared, I'm just going to deal with it. I'm going to do this home remedy. It works. Don't listen to this. I have this bush for you. I have this thing for you, or whatever. Or I'm going to go to maybe some of the holistic providers, which there is room for that, but also there's room for evidence-based medicine as well, right? So that's the first level of like, why is it too, and you're a care provider yourself too, because you do a lot of work in the healthcare system, you're talking, why are we able to tell our loved ones, you better go, but then for ourselves, not do the same for ourselves? Let me tell you, like, physicians are one of the most, and people don't put me on all of a sudden. Physicians are unhealthy. Don't do that. There is a big epidemic within healthcare providers as a whole with not having good healthcare themselves, right? Because we're taking care of other people and we're not always taking care of ourselves. Mentally, physically, not getting to our own checkups and those things too. So the question you have spans a lot. We can delve into any one of those things. And that always then goes back to my thing, the knowledge and the agency and the action, right? So you have the knowledge, you know what to do. Why are we not taking the steps? Different people have different reasons as to why that is. I think there's a lot of good reasons for that. We just have to know, why is it that I'm afraid? Is it because I had a bad experience with a care provider in the past? A lot of times that can be it too, Is it because I'm super sensitive to my reproductive health and I'm worried? Did I have a family member with cervical cancer or ovarian cancer and I'm scared I get that diagnosis? Or do I just not think it's important because I'm healthy and I know I'm fine and I don't need a checkup, right? So we have to kind of check ourselves as to what are those reasons. Finding the right care provider matters. And I do know that when people know their provider cares, and when people have that relationship with their provider, they're more likely to come back. That is a fact. So one of the like mantras or statements that I have everywhere is that the patient doesn't care how much you know until they know how much you care. I don't know where it comes from, but it's not mine. It comes from someone. Maybe we can find it and put that person.
Yes.
But it is true. It is so true. So, trial and error with providers, sometimes looking them up. I'm not big on like Google reviews, to be honest, because sometimes they don't always see the right.
And they'll pressure people to giving them good reviews too. That's the thing.
Thank you for that. So, finding sources, listening to your friends, asking for personal referrals, recommendations for providers, asking a doctor for another referral. There's so many ways to find a care provider that you may identify with better. I think all those things would help the first part, right? But I too struggle with that. So for me personally, I put it up on my list. Okay, before the end of this month, I must schedule my annual physical. I must schedule my this. I must, and then I come to the practicalities of I'm so busy, I need to do it for myself.
Yeah.
The second part of, wow, this is where my life work comes in. The living with misconceptions and suffering from like menstrual pain, pelvic pain, or other gynecological issues that we all grew up hearing. That's normal. It's a normal part of life. Meanwhile, our quality of life is substantially negatively impacted. That is my life work. And that is, I want to kind of let people know what's normal and okay, and I'm like, okay,
questionable.
Right. This is normal and okay, fine. This is normal and questionable. And then this is just not okay. Right. And a lot of that, I grew up with that too, hearing if you weren't vomiting and laying in bed for 3 days for your period, then that was not even a normal period, right?
Yes, I've heard that too. That's crazy. Yes.
Oh, let's do this. People can even walk in the house when I would have my period because any movement in the house made it bad.
Any sound, yes.
Any sound, anything makes it normal. So what I try to do is I have to educate both the person, the younger person or older person, right? Because this is not just limited to adolescents. We span the whole reproductive age. Is educating people as to like what is normal, right? And what is normal, and then what's happening for you, and are you in one of those three buckets? And a lot of times people are in the bucket of like it's normal but not okay, or questionable, or this is just not normal at all. And they thought that, I suffer every single month for weeks, for like 2 weeks out of the month I'm struggling, but I knew that that's okay. And I kind of have to go back to say, well, that's not okay, right? Because we're missing school, we're missing work, we're missing social activities. These are all mental health is a big thing. We talk about social for adolescents, but we know in the older population, depression is directly tied with lack of socialization. If you are unable to participate in family functions or in important functions because of your cycle or because of some other health concern, that is big. Right.
Yeah.
But then we have to traverse the provider mistrust, or you come into the office. And if I'm saying, okay, well, I think you should do this and that, the minute we bring up the medicines, they want medicine. No medicine. What else can we do? Are there things we can do? Absolutely. But sometimes medicine is a part of that. So spending.
I don't want to cut you off. I said that part again. There are things that we can do, but medicine is also a part of it. Because I think sometimes we forget that part. Like because of the mistrust, we just like, let's just put medicine to the side. It's part of the process as well.
Medicine is part of the process. And it's funny, like I have both extremes. I have some people, when you come to see me, we spend a lot of time talking. I talk, and then they talk back, which is good. I love to be able to provide time for people I see. But sometimes I spend half of the time talking about lifestyle changes, and people don't want to hear it sometimes. They're like, what do you mean? I just want that medicine. I'm like, well, it goes hand in hand. Talk about the medicine. They're like, what do you mean? I just want the lifestyle thing. So I spend a lot of time blending and saying, listen, a lot of times these things, holistic means all together, and find the option for you that is the most acceptable, but also has the least side effects. Everything I offer you is going to be safe because I'm not in the business of offering things that are not safe, for the most part, and things that have been tested and qualified before we basically go there. So so that's hopefully that answered the big part of your question. And then I'm happy to delve into like what's normal, because a lot of people do not know what.
Yes, because I want to talk about what's normal. The thing is, I have a love-hate relationship with the word normal. And the reason why, when I was in nursing school, I had a professor, something we were talking about, and she basically was trying to say that we shouldn't use the word normal when it comes to medicine because, you know, it can be subjective. It's just not going to be, my normal is not going to be your normal. Yeah. So we try to go from like, what's your baseline point of view? Like, you know, at that time we were doing like blood pressure checking at the time. And it's like, okay, what's usually your baseline when it comes to your blood pressure? Like, is it high? Is it low? Is it in between? So for me, no, I think that was one of the key takeaways I took from that moment.
Yeah.
I'm not a nurse anymore. Was never a nurse, but was on the journey to that. But every time I go to my doctor, and, you know, they're taking my blood pressure, oxygen, everything. You know, they have a thing where they won't necessarily tell me what it is. I'm like, okay, I need to know. Like, tell me what's my, because I know what my baseline is. If, you know, if I'm going to be 130 over something, that we got a problem because I don't run that high. You know, for me, I mean, while we're still in the normal range, for me, it'll still be a little bit high by my standard because my baseline. So like I said, that's why I say I have a love-hate relationship with normal. But I get why we use it, but from a menstrual cycle standpoint, you know, this is like where we probably spend more time. I don't know. I've had friends, like I said again, who to this day I'm vomiting, I'm in severe cramps. Then now, as we're older, some are now being diagnosed with PCOS or endometriosis and these different things. And I know we mentioned earlier about the importance of preventative measures or going to see your care provider even from a young age, because again, culturally, 12, 13, 14, 15, you know, you're having these severe pains and you're telling your parents you want to go see a doctor. The first thing they start thinking, oh, are you sexually active? And I'm just gonna say it because it's just I've seen it, you know, it's just the reality of it. Oh, are you sexually active? That's the first thing. So we're not even fostering a healthy communication when it comes to our bodies between our child and a parent, you know, because it's just a negative connotation. Oh, you're at the age now when you start your period, it automatically means something sexually, which is just so mind-blowing to me. How can a young person, or even whatever age group you fall into, who's now battling severe pain, severe menstrual pain, extreme heavy bleeding, how can we break down the importance of talking about this to your care provider, or even if your care provider may not? Because I know sometimes, I don't know if I want to say it, but I'm going to say it. Sometimes people are, I don't want to go because the first thing they're going to tell me is go on birth control.
Yes, yeah.
And that's just a big thing and that's a whole other episode that I'm going to record for this season too. But it's a big thing. And I'm like, you know, okay, you know, lifestyle and medicine, you know, they go hand in hand, of course. There's pros and cons to everything in life, but that's a misconception. Oh, I don't want to be in birth control, so I'm just going to sit here and suffer in silence. I'm just going to throw up every day. I'm going to be out for 2 weeks, can't work, can't have a social life. Then during that time with the changes in hormones, my mental health is deteriorating because I refuse to, quote unquote, find an alternative to alleviate my issues when it comes to the menstrual cycle. So what is some misconception when it comes to our menstrual cycle from a, I guess, obviously abnormal standpoint? Then, like, you know, a person with a heavy period, XYZ, you're being told to go and break control. Like, how can we debunk that? Like, how can we encourage those listening to speak up, one, to your care provider? I know we have that anxiety when it comes to dealing with our doctors, aka me. But if something is not right, you know there's something is not right, especially because I'm very passionate about reproductive health. I'm like, you know what? I tell myself not in my priming myself for pregnancy phase. That maybe 5 years from now, we don't know. But, you know, I'm trying to make these necessary lifestyle changes now. Yes. I'm noticing certain changes in my body, whether it's a body or whatever it is, a discharge, whatever the case may be. But again, these are not conversations that we are having openly enough.
Correct.
When we're talking about health literacy, again, we're not as literate when it comes to our health and our bodies because, again, society and depending on where you are in the world culturally, is just not welcomed enough. Mm-hmm. All right. So like, what are some misconceptions when it comes to your menstrual cycle, and how can we encourage the listeners to speak up, go get help? This is not normal, because you don't want to wait till you're 35 and then you're being told now that you have endometriosis. And then, you know, there's just so many other reproductive health issues that you could have prevented had you spoken up. So I guess we want to debunk some of these misconceptions from your line of work, from what you've seen with your population and just in your career.
So much.
I know I talk too much.
No. This is I mean, not so much in a bad way, so much as like
yeah.
I feel like this is like a 5-episode podcast.
I know.
But first, I completely agree with you with the word normal. And I tend to not use normal as it relates to someone's body in the office. Almost never. Like, not obviously sometimes I may say it or whatever, and then kind of because I completely agree, right? What does normal mean? So with the word normal, it's like a cop out a lot of times. I like how you kind of mentioned when you're relating to like your blood pressures, it's normal, but what is it? Because that's the only way that you then get to see small, subtle changes that impact your decision making before it becomes not normal, right? And what is the range of normal? So I love the fact that in your daily life, you've actually done that. I completely agree with your professor or whoever told you that before, because it's definitely true. And I don't use it in the office as it relates to people's bodies, because everyone's bodies is so very different. So I tend to use a word like, if I'm talking about menstrual cycles, like typical or sometimes normal, depending on what it is, or for their body itself. This is your body, and this is what's more typical, and this and that. And, there's a range and a spectrum. So I completely agree with that. The other part is like, what is a typical cycle, and what are some misconceptions we have? One of the first misconceptions we do have is that, to your point, if something is wrong with me and I walk into the doctor's office, they're going to just tell me, take a pill for that or take a medicine for that. And I heard one the other day that was like, well, if this was true, I'll be a millionaire. Doctors making money for like pushing drugs. And I'm like, who are these people? Who is this? Because it's not me. Are there providers out there who are getting paid by drug companies? Yeah, but those are not the norm and the typical. More often than not, that's not the reality at all, So that's the first misconception. And why is that? It's a misconception because a lot of times what we have to do is educate, right? So if someone comes and they have what's a typical menstrual cycle? It should be between 3 to 7 days long. So that's it. 3 days long to 7 days long. Depending on how old you are, they should be 3 weeks apart from the start of one to the start of the other, up to even 3 months apart, depending on how old you are. So whether you're in the younger population, as you get into adulthood, that should be every 3 to 6 weeks apart, or 21 to 35 to 40 days. And that's a typical menstrual cycle. As far as the amount of blood flow, that again is variable, but you should not be soaking through pads or tampons an hour and needing in excess of like 7 in an entire day. If you're using menstrual cups or period underwear, then you have to kind of figure out like how many times you need to change those, right? And, so these are the range of what we would typically see for people. If you are a person that is outside of that amount of bleeding, length of bleeding, or frequency of bleeding, that may actually signal that there is something else going on with your body, both something organic, meaning that we use the menstrual cycle as a vital sign, and it can sometimes show us there's an issue with your thyroid or a bleeding disorder or some other hormonal dysfunction or a structural issue like fibroids or something like that. So those are all, the amount of flow is all a signal and a trigger to say this is outside the typical range. I now need to go and get assessment. A part of that assessment may mean medicine, but it may also mean that you actually uncover something else, right? And that can be treated in a different way. As far as the amount of pain, there's a big misconception that the periods are supposed to be so painful that it's normal to miss a couple of days of work or school, something in that way, or to have such severe nausea and vomiting that it limits you. Those are not typical. And if you're having, cramping is a typical part of the menstrual cycle. Yeah. And with that, before having some nausea, having some diarrhea or some constipation or mood changes, all those fluctuations come as part of the normal cycle, either with hormones or with release of like inflammatory things in the body. But if the pain or any of the other functions are enough that it starts to impact your quality of life, that is no longer what we would consider acceptable. And that is something you need to similarly go and get evaluated for to find out, is it something organic? Is it something that I can just change how I eat and, eat foods that are more nutritious, less inflammatory, less processed foods, and, be more active, drink more water, and my body responds well to that? Or am I someone that can benefit from medication that actually would make my cycles less crampy, less heavy, and allow me to live a perfectly productive life? It's a common misconception that for the younger age group that I see, that when you first get your cycle, it's normal for it to like go away for like 6 months to a year and not have it regularly, right? That is completely false. Although it's common to not have a cycle be completely regular, whatever that means for you, 28 days or 25 days, you should have one at least once every 3 months. So if you're going more than 3 months without a period in the first year, that's also a signal. Similarly to if it's too close together, that's also signals for us to, be evaluated. The act of giving someone's medicine is also something that is not, maybe curated isn't the best word, but you think really intentionally about what you're giving, right? So sometimes there are people that I give medications for a short time. So if you have a person that comes in and they've been bleeding for a really long time, I may just give them a 10-day course of medication to stop that bleeding, trigger a cycle, and then just see what their body does after that. And then you get to gauge whether they need something in the long term, or I may hear someone with a lot of pain, family history of chronic pelvic pain or of endometriosis or something like that, and say, you know what, this is sounding like that as well. And for you and for your future, it's really important to try to protect your reproductive health and your reproductive future. So the act of going on the medication is something that's going to decrease that tissue and allow you to have a healthier life. The goal, as you kind of mentioned, is to protect your reproductive future. So the best way to go about doing that is to get those 11 and 12 and 13-year-olds, because they're not going to have these problems for the most part. They may have some of the bleeding things in the beginning.
Yeah.
But the 11 to 12 to 13-year-old, 14-year-olds, they're the people that's going to be the healthiest in most times. And you're going to be able. So what I do with them when I get them is I say, okay, let's talk just about this. This is how many days a cycle should be. This is how much pain you should have. This is how much sanitary pads or napkins, or what are you using? Tampons. There's always something new in the market, right? I have sometimes young people, they teach me, I'm like, oh, what is this? Okay, I've never heard this. And they teach me and I do it. And when you learn when you're that age, and I'm also teaching the older person in the room, when you learn when you're that age, then yes, when you're in your 20s or in your earlier teens and something comes up, then you're able to know, I need to see the doctor because this is happening. And when you go to that doctor, you're then able to say, this is happening to my body. And you're able to use the right words and verbalize that, particularly in settings where the provider may not be listening. Because although people who see me do have I don't want to call it a privilege because you're supposed to be afforded this, but they do have the opportunity to spend time with me because the kind of care provider I am. That's not universal. And sometimes a provider 10 minutes with you, right? How do you get past someone who has 10 minutes with you? I'm here because this is what is wrong with me. Right? Or I'm here because it used to be this way, but now it's not this way. You're going to walk out of the room not getting your questions answered if you're unable to verbalize that, because the doctor is going to go down a checklist of health, right? They're going down that, how's this, how's that, how's that? That's good. Okay, let's just do this in many instances. So, so that's why it's so important for those 11, 12, 13-year-olds. Yes, a lot of parents do think they're in there talking to my child about sex and all. Yeah. And a lot of times that's not even the case. It's truly not the case, So I see them together, but I have the parents step out, and the amount of resistance that comes with that. And sometimes I can imagine. What's the resistance for? Like, tell me why the resistance, because I think a lot of times they think gynecologists, they think sex. Yeah. And surprisingly enough, that is probably the least thing that I talk about, because many of our younger ones, they're not, or even if they are, we're able to kind of navigate that in a different way, right? So what I'm doing at that time is giving them the information or giving them the resources to use to help them and their friends and their family and their caregivers, so that when something comes up, they're able to kind of come back and talk about that, right? Fibroids, such a major problem for Black women. And I mean, internationally, it has destroyed so many lives, reproductive health, fertility potential, pain, you name it. Why is it so many of us are presenting in our 30s with this and not realizing that the signs were coming? The human body is it's not good enough. It's near perfection in many cases. Yes. It tells you. It tells us, tells us, and yet and still we're not. Why are we not going? So then we're limited to the big surgeries and the hysterectomies and the loss of fertility potential. Why? The knowledge and the agency was just not there. So we have to start earlier. And, you mentioned, I want to touch briefly on sexual health in a sense, because you mentioned about the use of tampons and these different period products that they have. And again, from a cultural standpoint, I hate to keep saying that, but I mean, it's just the reality. When you start your period from 12, 13, even 14, oh, you cannot use a tampon because the tampon is going to
break your virginity and these different things. So touching that as far, I guess, from an anatomy standpoint, briefly, as you know, when it comes to inserting a tampon, because that's something that we get to within my nonprofit organization. So we've made it a mission to not necessarily give tampons out because, again, culturally, you know, you have to read the room sometimes. You know,
read the room.
You have to read the room. So we've made it like an effort, even though we get them donated. We have to be mindful of which population we are giving the tampons out for, because that stigma surrounding tampons at an early age, it's mind blowing to me again. But you know, when you're in it at the time, you think it's normal. But as you grow and you elevate or you get educated, as we just talking about, you realize that no, that's not the case. So talk to us, I guess, from an anatomy standpoint, like when it comes to the tampon, like, let them know a tampon necessarily cannot break the virginity. You tell me, I don't know. You're talking to me like I'm a 5-year-old, okay? So when it comes to because we're trying to eliminate these cultural taboos. So let them know that, you know, when it comes to using a tampon, inserting a tampon, that it doesn't have like a negative effect that we often bring with that.
Yeah. Boy, if there was one misconception that is major, is this one. I completely understand. I was told the same thing growing up. So I love the community that was forced this. A tampon cannot break someone's, even if we want to use that word, virginity. It no longer takes you from a place of being not sexually active to sexually active, because that's what we think about with virginity, right? The act of having sex. That comes back from the thought of like when someone has sex for the first time, they break the hymen. Now the hymen is open, and now you're no longer virgin. So let's looking at anatomy. The hymen, what the hymen is that it's a piece of tissue that's between the vulva and the vagina. So remember, we talked about that the vagina is that tube that connects the vulva, right? So the hymen, I tell people, it's like the window of the vagina. That's the best way I can think about it. It's in some people, it's fluffy and it's thick, and some people it's really thin. The hymen's job is to actually open or break before you're even born. So it is, in normal cases, this is normal. In normal cases, before someone is born, their hymen already has an opening. If someone is born and the hymen is not opened or is not broken, then that's called an imperfect hymen, and that's a surgical emergency when the blood collects there. We need to open it later on, like not immediately, but after they have their puberty. So someone doesn't have the flow of menstrual blood. So there is already an opening there that is already ready for insertion of tampons or whatever other, or later sexual activity to do that. So inserting a tampon doesn't actually tear the hymen in any particular way that makes you sexually active. Now, can someone have some sort of small trauma, or can someone have difficulty in placing a tampon if the hymenal tissue is like larger than others? Then absolutely. And I have a lot of young people who come to me because they have difficulty placing a tampon because the opening is too small in order to do that. But again, that is not an act of having sex. I don't know why certain cultures, and our culture in particular, feel so strongly that the act of a tampon equates you with sexual activity. Also because I have a lot of young people who are sexually active but still refuse to wear a tampon. So
I've seen that too.
Just like, okay, parents let you use a tampon because it's sex, but you're having sex and they don't know about the sex. So it does not actually. So some parents are, because then they think they can have sex. It actually is not at all correlated. What it is correlated with is children being able to swim and do multiple activities while they're on their menstrual cycle. And it gives them that freedom to do so for someone who that's acceptable. Now, if I have a young person that they are an athlete or they do bleed a little heavier, they had a couple of accidents in school, the use of the tampon is actually very helpful because it allows them to have a sense of security and safety, and they can double up with a pad under to make sure they're not overflowing or make sure they're not having an accident, if you want to call it that word, or some sort of event that could be deemed embarrassing in school or in their social life. They are able to engage in more activities that way. But they want to be able to make sure they're doing it in a safe way and in the right way. So no, it does not tear the hymen. It doesn't break the hymen. It does not make them lose their virginity, because the only thing that allows someone to lose their virginity, if we're using that word, I am also kind of against that word as well.
Ooh, so what word should we be using? Tell me.
Active.
Yes.
Active. Are we sexually active? And, that's because that's what it is. But, that's the word that a lot of us use anyway, virginity. So it's free.
Yeah, no, I get it. Yeah.
It does not. The only thing that breaks someone's virginity or has them lose their virginity is the act of sexual intercourse. Specifically penetrative vaginal intercourse in that way. Someone can be sexually active orally, anally, other ways. I have a lot of young people that are sexually active in those ways, but they still consider themselves a virgin. Why? Because they've never had penetrative vaginal intercourse, So I'm still a virgin because I've never had vaginal sex, but anal sex and oral sex has been happening for years. And with that comes risks as well. So, yeah.
And as I'm listening to you talk, I want to talk as we're getting ready to wrap up because I know you're busy and have to go. But as it relates
I want to come back.
Yes, I'm already thinking about what I'm going to bring you back for. But from sexual health, again, because, we're talking about that health literacy and these different things. As we're getting ready to go, how can we approach? Like, what is it that we can do? So I want to ask you two questions, but I'll ask this one first. What is it that we can do, again, because I'm seeing, we're talking about virginity or saying the word sexual or sexually active, again, it's still taboo. Individuals are having sex at an earlier age. I'm not a parent yet, but as a parent or even someone who's working in our field, we cannot prevent someone from not having sex. Like I don't care what you try to do, you can let them. They'll find a way. There'll be a way for you to engage in sexual activities. But how can we approach the topic? Because I remember for me when I was in high school, I forgot, and I can't remember the name of the organization, but we had different classes from time to time where we learned how to put on a condom, both male and female. We learn about these different things. I don't even think it's still happening in the schools now, which is probably what's missing in our society at this point in time. But we learned that during that time, and I think that's even one of the reasons why I'm now in this field without even realizing. But how can we create or provide the education surrounding sexual health or sexual activity without it being so taboo? Because 15, 16, you're going to have sex. Okay, I can't stop you. If you're going to have sex, as a parent, I may not want you to be having sex this early, but the chances are you're going to. Outside of, because I've seen parents put their child or children on birth control because you're not going to get pregnant. Yeah. But that's not the only thing. So that how can we approach the conversation as to, maybe, I guess I'll say, you can correct me, why it's okay if you're going to have sexual intercourse, or you're going to be sexually active, how can you be safe? Like, let's talk about safe practices. Yeah. What are some things that I should know as a 15, 16, even 25-year-old, whatever, I should know when it comes to sex? I want you to just answer that question so we can, I guess, destigmatize it, because it's going to happen. So when it's going to happen, let's educate, let's talk about safe practices, let's talk about all these different things so that we can ensure that both parties or parties involved know what they're doing,
Yeah, no, absolutely. Destigmatizing sex again. And a lot of this stuff stems again from these historical myths and misconceptions that we've just brought with us through generations. When there was a safety issue 300 years ago, now we're in a different place, but we're still using some of the same things. So, first, let me say, if anyone is in a position where they feel strongly that they are not wanting to have sex either until marriage, until they feel so, that is fine. And that's free. Yes. That's good. And that is your choice. It's not right or wrong. It's right for you as an individual. If anyone is feeling coerced into having sexual activity, meaning that you really don't want to, but you're with someone who is like encouraging you to do it, and you say, okay, I might as well, that's called sexual coercion, and that is something that is wrong as well, right? But barring those situations, it is healthy. It's a part of normal growth and development to explore, particularly adolescence and young adulthood, and having sex is a part of that. We actually have a talk coming up in our national conference, the North American Society for Pediatric and Adolescent Gynecology, NASPAG, talking to care providers about whose responsibility is it to talk about sex and sexuality. And this person she's from Jamaica, actually. I have to make it very Caribbean.
Yes, of course.
But, and she's going to be speaking to care providers, because we still don't always know whose responsibility is it and how do you do that. And when I have a lot of people come to me with parents saying, can you talk to her and tell her don't have sex? My first step is to say, take a step back and ask that person, well, why? Well, why? And number two, what have you all spoke about, right?
Right.
Because if we're not talking to our children about sex and all we're doing is throwing them a book or giving them birth control or saying, don't do it, we're setting them up for failure. We're setting them up for a higher risk of having sexually transmitted infections. a higher rate of sexual coercion, a higher rate of unintended pregnancies, because we're not giving them the information, and with that doesn't come the agency, right? So the way I always breach it is, you kind of mentioned about good touch, bad touch before. So when you have your younger children, you're speaking to them about the safety of their body, what is private to them, what is good, what is not good. As children start to go through puberty and get older, the conversation has to shift. Naturally, 10, 11, 12-year-olds are going to start becoming curious. They're going to see things, social media, TV, everything. You see a little, let me see a little breast, a little penis, a little vagina. I don't know. Things pop out. You have to speak to your children about that. Children should know what sex is by the time they're 11 or 12. They should know what sex is and what is the outcome of sex. What are some good things that can come of it? What is some downsides that can come of it, right? As they get more, emotionally and physically mature, particularly as you're going into the high school, that's when you really, it's time to kind of sit with your child and have that heart to heart. So you should be building that relationship already, where this person feels comfortable coming to you, or you all have already had these conversations. It's going to be very hard to look at a 16-year-old that you've just been avoiding the topic or not talking to at all, and then expecting them to be honest with you, because they're going to be worried that you're going to be mad at them for having sex, or expecting them to be open about that or wanting to have that discussion. So, but even if you hadn't had that discussion because you were just uncomfortable, and then you heard this podcast, now you're like, oh, I have some catching up to do.
Yes.
It's okay to go to them in a time of like relaxation, right? This is not when you're having an argument. And are you having sex? This is not the time. They're gonna. So how's school? Is there someone that you like, or like you, or you may already know they have a little significant other? That this is a time to ask them. So have you guys talked about being intimate? Okay, well, it's okay. Like, I just want to make sure that I can support you. Like, so what kind of intimacy? And have you thought about having sex? And if the answer is yes, you can be honest and say, even if I may not like it, I love you and I care about you too much to not give you the information. So if you are, let's just make sure you have what's necessary, right? The birth control options, condoms for infection prevention, minimizing the amount of partners they have and the exposures, knowing your partner, knowing who's his partner with, getting tested for infections routinely. Parents or caregivers, loved ones, leaders, they have to be able to be honest with themselves and let them know that these young people are going to make these decisions anyway. We have to arm them with the right information. And to be honest, from what I've seen, is the young people who actually have more knowledge about sexual activity, the ones who say, oh yeah, my mom or my dad or whoever's about, they're not having as much sex as they think they are. Yeah. Like, we actually did a study. I did a study about this when I was in fellowship, and the amount of times you would ask the young person if they're sexually active, and ask their parents if the parents think they're sexually active, the parents were thinking the children are having way more sex than they are. But that didn't mean that they were actually like talking to them about it, Yeah. So I find if you start to educate your child or the young person, regardless of what their age is, and having those conversations, you're able to actually lead to some, they're engaging in sexual activity at an age appropriate time. And when they have the information, in Europe, and don't tag me and put me on something later. She said the Europeans are better. I did not say that.
She did not.
In some European countries, parents are so open and engaged with their sexual activity, and they have much lower unintended pregnancy rates than in the United States, right?
Yeah.
These parents are not villainizing it. Some of my European parents, when they come, they're like, this hurts her and she must be able to have sex if she wants to. So I just want to make sure that she's fine because she told me it was uncomfortable. They have demystified and taken away the taboo, and the person may or may not be interested in having sex. It's no longer something I can sneak in the corner and do and I'm grown. It's like, okay, yeah, when I'm ready, I'll do that. But it's no longer like a point of like autonomy, They fight for their autonomy. And if you're not going to give it to me, I'm going to take it, So hopefully that answered the question.
Yeah, it did. And as we wrap up, I do want to ask, because I know you do a lot of work in the community, but what are some ways that we can, or some actions that we can do or take to ensure that we are promoting health literacy, body literacy in our communities? Sometimes a person may be thinking, I had the particular amount of followers. Like, I know for me, at one point I was like, I had to be a millionaire to start my nonprofit. I'm not there yet. Maybe one day I'll get to that. It's a dream, but I thought I had to, and then realizing, I used some of my experiences, and one of the reasons why I even started Scrub Life Kids was when I did my study abroad in Uganda, and just realizing that similar culture from being in the Caribbean and Africa, to be quite honest, but also the lack of education. I tell people all the time, I can go and donate cases of pads and tampons, whatever, to an organization, to a school. That's easy. I'm not saying it's easy, because no, it's not. It's challenging, but to me, that's the easier part.
Yeah.
But what we lack is the education.
Mm-hmm.
And I had someone ask me one time, what can you educate about sex? What can you educate about periods? And I'm like, I said, there's a lot. I said, we can be here for an eternity.
Yeah.
For the amount of education that we can provide. It's not just, your period, heavy period. No, again, reproductive health. That's just one part or one phase. You know what I mean? Mm-hmm. So how can individuals in our community, I guess, work towards maybe starting an initiative or whatever it is, so that we can ensure that we are promoting our health literacy for our younger generation? Because, some of us are older now, but again, as you mentioned earlier, it starts from 12, 13. Once they're aware from a younger age, it sets them up for a much better future when it comes to their reproductive health and even their overall health. Because again, everything goes hand in hand at the end of the day.
Hand in hand.
So, like, what are some things we can do when it comes to addressing these important topics? Because again, we're doing our part. We're just two people, and of course, there are other people as well. But again, what can we do to ensure that we continue this conversation?
I actually want to do more myself in my free time, all the free time in the world I have. That's something I want to do more, but we just have to use what we have, because I think it's really established, like, it's hard when you start thinking about, I need to do this and that. Just use the resources you have. And what do we have? We have our loved ones, we have our families, and we have our minds. So what can everyone do, even after listening to that? Educate yourself. So from credible resources, and then talk to your parents, talk to your cousins, your aunts, your uncles. If you are a person that is religious and you go to organized religion, church or mosque or something in some way, that is a nice opportunity to actually bring in a health provider, or you may have a nurse or a doctor in your congregation. Have seminars, that where you can say, okay, this Saturday or Sunday, we're actually going to have a health fair, and we're just going to talk about what is normal blood pressures, what's typical blood pressures, or what is diabetes and how you get it. The schools, that's another way, you can find out, does your children's school have health class? And if they have health class, do they speak? What do they talk about in health class, right? Are they talking about overall health? Are they talking about culturally appropriate health things that we tend to be disproportionately affected with? And if they're not, you can actually ask them to, encourage the curriculum to be a little bit more inclusive of things that we actually face, right? Yes. These are things that does not take any money for the most part. It doesn't take a lot of effort. We already have PTA meetings for the most part, and there's everything. You can Zoom everything. You can ask and you can request, and the schools can do it. And as you said, a lot of schools have moved away from doing a lot of health class or speaking to some of these things that they think is more taboo. So even if they can't put it in the curriculum, maybe they can have a little after school initiative where they do that like once every XYZ.
Yeah.
Same for the jobs. You're working at a job, you can encourage a job to have like health pamphlets, and every couple of months they talk about another disease process or another preventative process, right? And it could be simple as like, what is the recommended screenings for your age? I'm a 45, not me, I'm not 45 yet, guys, but let's say I'm a 45-year, and no shade, I love this in the 40s.
Yeah, but you're not there yet. We get it. You're not there yet.
I'm coming, not that far from now. But what is a typical screening for a 45-year-old person, right? Man and woman, based on my risk factors. And then one thing could even be like, what is my family history? That is a lot. Yeah. You can take that stuff. So those are just little things that we can do in our community to make health literacy a little bit more tangible. But I would say it all starts from seeking the information for yourself first, right? What's that thing? Give the man a fish, you'll feed him for today, but give him a rod, you'll feed him forever. Again, we need to find out where that came from.
Yeah. Well, I've heard it before. We got to, it's been a mantra in our lives. It's true, Yes. But I'll find that.
Yeah, you know what? Well, but that's what I think. And I just want to leave with saying this. I would be remiss if I don't every time I speak, I have to say this. Speak up, Come to your providers with a list of questions because, like I said, we all struggle. You get into that room and you have no idea what you were supposed to say and the emotions you were supposed to emit. So just write them down. Don't come with 20 questions now because, again,
timing.
You may have to schedule, you may have your top 3, then you may have to schedule a whole other visit just to discuss something in particular. And that's okay. There's a lot of virtual visit options and all those things. You can do that, but come prepared to the visit. Come with your questions. Come with questions for the provider. Just as you said, what is my blood pressure? Oh, your hemoglobin A1C is this. Well, what should it be? How do I get it there? Instead of this meds, is there something else that I can do? And if I do that, can you help me? Sometimes the doctors aren't the people to help you. Sometimes they have to refer you to a nutritionist, or to a physical therapist for that hip pain, or ask you, how many times are you moving your body in a week? Are you moving your body? No. Okay, well, here we go. So just, speak up, advocate for yourself. And if you come across a provider that you don't think is listening to you, doesn't hear you, or is not addressing your questions, then seek care from someone else.
No, I agree.
I always want my people to know that because it's so important. There's a lot of people who are still with the same providers and they are not happy and they're scared to go back and they're not taking their meds because that doctor didn't explain it. So I'm not going to take my medication. And now they're the only ones that's suffering is them and their loved ones.
Yeah, no, that is true. That is true. Well, on that note, I want to say thank you. What better way to end an episode? Thank you. Thank you for taking time out of your extremely, extremely, extremely busy schedule to sit and talk with me and my tea tasters, as I call them. It was very informative. I love talking with you. I'm already thinking about, okay, what else can I have back on here to talk about? Because, it's just an important conversation to have. And again, like I said, we're not talking about it enough, or we're just touching the base of certain things just enough to not cross any boundaries. And we can't continue as a society or as a community to keep just towing the line and not necessarily crossing that line when it needs to. Some things we got to cross the line. Some things we got to dial it back in life. But there are some things, and being health literate is one of those things that we got to cross the line because we got to be our best selves. I told myself my goal for 2024 is to be as healthy as I possibly can be, even though I'm taking necessary steps. Again, like you mentioned earlier, good is better than perfect sometimes. We're overachievers, but if it's good enough, at least you're doing your best. It's good enough. And that's just one thing that we have to take away with us. But before we go, tell the people where they can find you. I know you have a lot going on and you're not the biggest fan of social media, but let them know where they can find you, what you have coming up.
Where can you find me? I know it's so funny. So I am only now getting into the social media thing. Maybe I'm camera shy. I don't know, but
no, I get it. I'm the same way too. So no judgments here.
You can find me on just Instagram for now. I'm not on TikTok or any other things yet, but I probably will be soon. Dr. Trotman, so DrTrotman. That's on Instagram. That's where you can find me. Eventually I do want to expand my health literacy platform. So I'm sure I'll have websites and opportunities for like learning and community engagement.
I'm going to make sure she does it, guys. One thing about me. So she thinks it's just like, oh yeah, I'm talking to Tanya right now. No, she don't know.
Tanya doesn't know. She's in my driftwood because no, you are because exactly really? Because you and I connected on social media at the time where I kept saying, I need to get my health literacy work off the ground. And then you had this thing and I'm like, this is exactly what I want to do. But that I'm like, that, right? So I'm in Antigua and then I see your thing and it was just so perfect. And
you have me blushing. Oh,
no. So you said, I'm like a mentor, but you honestly, I look at you in awe. I'm like, look at how amazing. So you don't have to have the MD behind your name to impact populations, and what you're doing is so very important. So I want to continue to encourage you in that. And I definitely want to come to do it with you one year.
Yes.
I said that and I mean it. And I want to do it throughout the Caribbean as a whole because there is such a need. So, more to come on that, right?
Oh, thank you. Thank you so much. That just validated everything because, sometimes in life you have doubts. So thank you for saying those kind words. I really do appreciate it.
Yeah, absolutely. Well, thanks for having me.
Yes, thanks for coming. I hope to see you back here in the tea tasting room some other time really soon.
I will be there.
Thank you for joining me for another episode of Tea with Tanya. If you like this episode, be sure to share it with a friend. Don't forget to follow on Instagram at Tea with Tanya Podcast. Be sure to subscribe to the weekly Tea Talk newsletter. And of course, rate on Apple or Spotify and subscribe wherever you listen. See you next time. I love you for listening.